We call foundation training the universal accessory. And it goes across the spectrum of human movement from the upper echelon, high-level professional athlete, the people that, like you said, make their living based on their performance, all the way across the spectrum to the person that is sitting at their couch or at their desk right now, wondering why for the past 30 years, even though they go to the chiropractor, they've gone to the doctors, they've taken their non-steroidal anti-inflammatories.
And they're working out all the time.
They're working out all the time.
Right.
They're on the elliptical, they're on the bike, they're on the treadmill, they're doing this, they're doing all these different things, but they're doing it wrong. And it's not because they're told to do it wrong. It's because their body has adopted a movement pattern that doesn't allow them to use the strongest muscles in their body properly. So to get that anecdotal evidence from the professional athletes and then go all the way across the spectrum to the furthest thing from professional athletes who have the exact same movement pattern breakdowns because of sitting, because of this kind of complacent adaptation, as I call it all the time. It works. And that's what I would never say that, except for how many people I've seen it work for, including myself for the past 7 years. I'm healthy, I'm strong, I'm a better athlete than I've ever been, I'm fitter than I've ever been, and I don't have back pain anymore, which blows my mind still. What I have found, again, this isn't a theory that I had, this is what I have found personally and through the many patients and clients that I've worked with, is that the core is anything that connects to the pelvis, whether above it or below it. And that's where we really start to lose people, is when we start thinking of the hamstrings and the glutes and the adductor muscles and all of these other muscles as the core. And what foundation training does is it teaches those muscles to work together. It teaches integrated chains of movement as we're structurally designed to use, as opposed to compartmentalized movement. So a crunch is a very compartmentalized movement. My primary exercise, the founder, the one that everybody has to learn the first couple days of doing this, is an integrated movement. We take your entire posterior chain of muscles and we pull them together. Any pulley system in the world is stronger, exponentially stronger, the more pulleys you add in. Every exercise in foundation training adds as many muscles into a given movement as possible, dispersing more force throughout the body, taking friction away from joints, putting that tension into muscles instead. So flexibility changes happen fast. Postural changes happen extremely fast. Strength changes happen fast. Pain changes happen fast. Every exercise we teach in foundation training is based on the principle that our bodies are designed to hinge properly, muscularly, as opposed to bend improperly based on joints. The only reason that I focus so heavily on the posterior chain is our modern lifestyles. It's not that these are more important muscles. It's that our modern lifestyles have pulled us out of them. Our glutes, our hamstrings, our lower back, they don't work anymore as they're designed to. They're a team, they're teammates, and we've separated them, and they're angry, and they're not able to function properly until they connect again. There was no other time in our lives where it was a requirement that we strengthened our posterior chain as we have to now.
There's a good point.
We offer the physiological change that needs to happen to counter the effects of this. It's a very, very important change to make, and I cannot wait. If there's anybody that ends up watching this that has any ins to clinical studies, please, I want to do clinical studies to show the effectiveness of this.
This is what you need to do before you engage in an exercise program to make sure that your exercise doesn't injure you.
The more exercise, proper exercise they do, focusing on basic fundamental human movement patterns before adding any resistance to a flawed system. And by resistance, I mean this, bicep curls, all the way to squats, deadlifts, and other types of Olympic lifts that are otherwise thought to be postural improvers. But if you're doing them improperly, they're not. They're breaking you down further. They're actually adding resistance to a system in the wrong places, furthering degeneration. Whereas if you do them correctly and you're really able to disperse that tension properly, you have an exercise that is building you up very quickly, really helping your body succeed in life. The hardest part of foundation training, bar none, is the first 2 weeks. Because your body's adapting. It's an active adaptive process. If you've got a couple months where you're training, if you have the next couple months to build yourself up, I want you to stop what you're doing. I want you to go back and I want you to go to basic fundamental movement patterns 3 times a week, 5 times a week, 7 times a week, whatever. Learn our basic body weight exercises and then apply them to your training. And then after a couple weeks, go back into it. Slowly, gradually go back into the exercises that you were doing as if you've never done them before. Let your body readapt to a better movement pattern in doing them, and you'll notice that you become extremely strong. You'll become stronger in your Olympic lifting. You'll become stronger in your weightlifting. You'll become stronger on the elliptical or on the bike that you're riding. You'll be a better runner. You'll be a better triathlete, better swimmer. You will. And I only say that because
you've seen it
so many times.
Yeah.